Okay, so I think we'll get started now, and as everyone continues joining, we'll just kind of cover the introductory stuff, and then hopefully that gives people a couple more minutes to join. So thank you for joining. For anyone who doesn't know me, my name is Zach Pemberton-Whiteley. I'm Patient Advocacy Director at Leukaemia Care, and I'm also the current chair of the Blood Cancer Alliance. The Blood Cancer Alliance is a coalition of charities supporting people who are living with blood cancer. We've obviously organised this webinar today to discuss shielding and giving top tips on keeping well with blood cancer, as well as an opportunity for anybody who's joined to ask questions of the panelists. So thank you for bearing with us whilst we sorted out the technology. As I said, we're here on Zoom, but we're also broadcasting live on Facebook. We've received quite a few questions in advance, which I'm going to be putting to the panelists, but you're also able to ask questions either in the chat function on Zoom or by commenting on the live stream on Facebook. I've got a number of people from all of the different blood cancer charities, social media teams standing by to send across the questions, so that I'm able to ask some of the panelists. So firstly, thank you to all of the panelists for giving up their time for joining. Thank you to all of the different blood cancer charities who've been involved in organising this. And thank you everyone for joining as well. We'll try to cover as many of the questions as we can in the time. A couple of riders to say. The information that we're providing is current as of today. As I'm sure you'll all have seen in the news, things are changing even today. So we're giving information that's current as we know it, but please do bear with us if things change, as things are changing very quickly at the moment. We also cannot answer any medical questions, so we're happy to answer any questions on keeping well and with shielding. But if you have any medical questions, please follow this up with your healthcare team or one of the individual charities. So, as I said, for anyone who wasn't here at the start, I'm Zach Pemberton-Whiteley. I'll be chairing today. I'm also joined by a number of panelists who are each going to introduce themselves now before we get started. So Helen, would you be able to introduce yourself first?
Yeah, hello everybody. My name's Helen. I'm a clinical psychologist and I'm based at Southampton General Hospital. I work in the transplant team there half-time with a colleague who works half-time as well. We work predominantly with people who've about to have or have had an allo transplant, and I've been in post for 1 year so far out of 3 years funded by the Anthony Nolan.
Thank you. And Jill, could you introduce yourself?
Yes, thank you. Good afternoon, and thank you to the Alliance for asking me to take part in this. I'm Jill, and I have retired from clinical practice. I was a clinical nurse specialist for many, many years in a large teaching hospital in London. My speciality was acute leukemia and bone marrow transplant, predominantly allogeneic transplant. I also had a bit of a sideline to, as was then Bloodwise, but is now Blood Cancer UK, and was a part of their clinical advisory panel. So I've always maintained links with them. I retired last year to do a bit more travelling and got back early March, and things changed quite quickly. I was invited to be a part of Bloodwise, as it still was then, is now Blood Cancer UK, to help support patients on the phone lines and just to answer any queries, and also to help address the needs on their website for patients, carers and healthcare professionals.
Thank you, Jill. And Sandra, could you introduce yourself?
Hi, I'm Sandra Quinn. I'm the Patient and Carer Support Manager at Myeloma UK. I oversee the Myeloma Infoline and Ask the Nurse email services and the team that provide those services. I also work with our coordinator with our support groups across the UK. And I'm also one of the editors on the Myeloma Matters and the Amyloidosis Matters magazines. I have a PhD in psychology. I'm a cognitive neuroscientist, but I've also worked in healthcare and in oncology, psycho-oncology as a researcher, as well as other kind of chronic diseases as well. Yeah.
Thank you. And David, could you introduce yourself as well?
Yeah, hello, my name is David Isles. I'm a retired engineer. I have had chronic non-Hodgkin's lymphoma since 2008 and attended pioneering drug trial treatment. I sit on a number of groups and committees. I'm a supporter of Lymphoma Action, and I am the local chair for the Teesside Lymphoma Support Group and some haematology specialist groups I also sit on.
Excellent, thank you. And last but not least, Steve, could you introduce yourself?
Hi there, my name is Steve. Good afternoon, everybody. I am a patient, a transplant patient, having had an allogenic transplant in 2013 for acute lymphoblastic leukemia. I now serve as a volunteer working for Anthony Nolan as one of the patient champions on the Anthony Nolan Patient and Families Forum, where we support patients going through transplants. I do still work, so my regular job is a project manager, construction project manager. Interestingly enough, normally building hospitals, but yeah, so that's me.
Thank you, everyone, for introducing yourself. Just to say, we've got a few questions coming in already using the chat function, but for anyone who doesn't know who's here on Zoom, the chat function, you just go at the bottom and it's a little message bubble. And also, obviously, you can ask any questions on Facebook. So I'll start with Helen. Could you give a little bit of a position as a psychologist on shielding, just kind of a couple of minutes of your view?
Yeah, absolutely. So I guess we're all in a position where we find ourselves in the most extraordinary circumstances, I think. But actually someone used an analogy yesterday that I thought was really interesting, which is that we're not all in the same boat. We're all in the same storm, but we're not all in the same boat. And actually for each of us, we face different challenges with this. And I guess for those of you attending this, you will find probably that your situation doesn't look the same as the next person's. I think shielding is very challenging. I think any level of isolation is challenging. Some patients I've spoken to have felt that they are almost uniquely equipped to manage because of their own experiences so far. However, others feel like it's almost brought up previous issues that they thought they'd been able to leave behind. Some others, it's come at the most awful of times in that they were just getting out in the world again, and now this is kind of put the end to that for the time being. So I think we're all in extraordinary circumstances. I think how we manage that and how that looks for each of us is so different that it's hard to generalize. So there will be times when I will say today, it's very hard to give a general statement. However, there are certain things that are potentially available to everybody and out there for people to manage the current circumstances. And hopefully today there'll be an opportunity to think a bit about how we all manage our mental health through these circumstances. And of course, anything specific to having blood cancer through all of this, hopefully we'll be able to cover a little more. Some things won't have answers. I think that's probably fair to say, but there's an extraordinary amount of uncertainty at present. And human beings don't like uncertainty very much. We're not very good at it. It's not a skill. And unfortunately, almost everything is uncertain right now. So I think there are good reasons that we're all struggling in our own ways. But as I say, hopefully today will be an opportunity to really think about that and address some burning issues for you all. I think that's everything from me for now.
Thank you, Helen. And Jill, have you got any comments to make at the outset?
No, I mean, I would agree with that really, that it's the people that I've been speaking to that have been contacting Blood Cancer UK, there's across the whole spectrum. Some patients are familiar with the concept of isolation, which is slightly different, but having gone through a lot of treatments in hospital, they feel that they are mentally prepared and able to cope with being in isolation. For others, it's just something that they have never experienced. I think from the blood cancer perspective, the patients that I have spoken to, what seems to be a concern for them really has been that there has been this is kind of difference depending on where you are in the country, and actually this difficulty with who should be shielding and who shouldn't be shielding, and it doesn't seem to have been a one size fits all. And that's been one of the issues that we've certainly found, that people have been anxious about that, not knowing whether they should, and having spoken to somebody else perhaps with the same diagnosis, and that individual has been given slightly different information. So that's been a bit of a challenge.
Thank you, Jill. And Sandra, any opening comments from you?
Yeah, I share what's just been said. You know, for myeloma patients and those actually with related conditions as well, it's been quite a challenging time. We've had an unprecedented increase in our service use because people have had to get their head around what is an entirely new situation. So as has already been said, some people have coped incredibly well. It's just been about trying to understand what the recommendations have been and what the guidance means for them individually. Others, not so much. They've found it more challenging. It's really been it's been different for everyone, I think. And I think that what we are trying to do as an organisation on our helpline is to try and help people understand what the different categories are for shielding, self-isolating. Staying at home was one thing that took some time to help people understand. In addition to that, it's been around what are my risks? So what's the risk of catching the coronavirus, which has been another thing that patients and families have asked about. How they manage the shielding guidelines at home, because not everyone's home is equipped, say, to follow all of the guidelines that have been put out there. And also keeping abreast of the information as it changes over time. As the guidelines have changed, we've got to try and keep up to date with that. So we've really been very busy, but obviously it's about making sure that we provide evidence-based information and make it as clear as possible for patients and families so that they can best follow that advice.
Thank you, Sandra. And David, any comments you want to make from your perspective of living with a lymphoma at this time?
Yeah, I think from myself and some of the groups that we've spoken to within Lymphoma Action, obviously people have a variety of experiences, but for myself, I feel that a lot of people forget about the terrible burden on your immediate family, not just yourself. I think it's very easy to forget that because we have no physical contact, you know, hugs from grandchildren, etc., and socially isolating down the phone, we're not actually meeting people. So I think that's one of the hardest, from my own personal perspective. I know that there's a lot of anxiety going around into the world at the moment, and when will it be safe for vulnerable people? But I suppose we'll come on to that. But that's certainly my own experience.
Thank you, David. And again, last but not least, Steve, anything to add from your perspective post-transplant?
No, I think I agree with what's already been said. I think having gone through a stem cell transplant and being in that position where your immune system is compromised, I think it makes you even more acutely aware of hygiene and infection control. So I think it's become the norm anyway just to be a little bit more precautious and look after yourself. So I think a lot of the things that have been introduced, some things that transplant patients probably exercise anyway. It's just a heightened awareness of those around you as well, which certainly helps. But no, I think it's almost been like stepping back 3 or 4 years for me, working from home again, being careful when I'm out and about. I've not been totally shielding, but I have been very cautious when if I've been out exercising or having to go shopping.
Okay, thank you. So as I said, we've got a number of questions come through in advance and questions coming through from Facebook and Zoom. So we'll start with some of the ones relating to specifically to shielding. Jill, perhaps could you explain to us what shielding is for anybody who doesn't know, just to be really clear?
Certainly. And I think, you know, there's been a lot of confusion in the early days. You know, there's been quite a few terms that have been bandied around. There's shielding, there's social distancing, isolation, and it's taken people a little while to really understand what the difference is, and I include myself in that. And shielding is what the government is recommending those people who are vulnerable. So anybody with a blood cancer diagnosis is considered to be vulnerable, and they have been advised to stay home and not to leave their home and to mix with other people, to go shopping, to work, to see family, to go out and exercise, to lower their risk of getting the virus.
Thank you, Jill. And just to kind of comment on the difference between shielding and self-isolating or lockdown for kind of the general population, which we know is now changing. What about things like exercise? Under shielding, should somebody who's meant to be shielding from the government guidance be going out to do exercise once a day?
No, the recommendation is that if you are shielding, that you should remain at home and maintain social distancing within the home with other people that are in the same environment as you. And so, yes, exercise, and I'm sure the psychologist will comment on this, that exercise, of course, is good for your physical health and also, particularly at a time like this, for your mental health. But that should be done within the home environment and not outside, which is a big difference between people who are, as you say, in you know, the general public who are in lockdown and are allowed to go out is different for those who are shielding.
Thank you. Sandra, do you have any comments on people who are at home and what they can do to perhaps enable them to exercise within the home?
Yeah, I mean, people can use a private garden or a private space if they do have one, so they can go outside, but obviously with those restrictions in place. It is important to try and get as much fresh air and get out into those spaces if you have them, but that's obviously only for those who have a garden space. For those who don't, one of the things that we would recommend is to open the windows, get as much fresh air into your own home. It depends obviously on your clinical situation as well. So it's best to try and check in with the clinical team to see if you can actually undertake some exercise and what kinds of exercise, if you're allowed, you know, if you're potentially allowed to do so. So what the limits of that would be for your individual case. But, you know, it's, you know, if you can do some exercise or physical activity in home, then it's encouraged. But obviously, if you have an outdoor space, a garden or some private space, then yeah, feel free to use that and you're encouraged to do so.
Thank you. Jill, again, I know Blood Cancer UK have been raising awareness of the fact that lots of people have not received a shielding letter. Yet telling them to shield. Obviously, the government guidance is clear as to that if you have one of the blood cancer types mentioned, that you should be shielding. But what can you do if you haven't had a letter?
The advice is to contact whoever is treating you, and that might be your GP or that might be a consultant at a hospital. But they should be the ones that register you as vulnerable and trigger a letter. All the guidelines that and our recommendations, of course, are on our website, but there is also an option for patients to register their own themselves as vulnerable. So there's a few things that people can do, but in the first instance, the best thing to do is to contact who is taking responsibility for your care. As I say, whether that's the hospital, it might be contacting your consultant, it might be going through to your clinical nurse specialist, or to your GP. And I think particularly those people who are under maybe GPs, that, you know, that, yes, you can imagine a GP has a whole array of people that they are looking after. So they maybe don't have the same specialist knowledge that some of the hospitals do. And just by contacting them and raising your concern and, you know, even being able to go and quote one of the charities to say, these are the guidelines on this charity's website, can be helpful for that individual. Thank
you, Jill. And just to also say,
do raise it. Don't just sit there and think, oh, well, I didn't get my letter, so what can I do? That, you know, there is help out there, and if it means contacting one of us via the support line or the website, etc., then we're happy to do so and to give advice where we can.
Thank you. And just to say, even if you haven't received a letter, but you have clinical guidance that you are categorised as vulnerable, obviously the guidance is to shield
Yes.
anyway. That then means some of the support provisions that come with a shielding letter are not in place, but which we can perhaps talk about now. So David or Steve, do either of you want to comment as to, from your perspective, both of you are obviously in the vulnerable category and being asked to shield. Perhaps David first, do you want to talk about what it's like from your perspective?
Well, I have received the letter, and I think the guidelines were quite clear, but the feedback that I've had from the other people in our support groups is that the majority of people are going out for a walk at some stage, whether that's late on an evening or the fact they live out in the country, they feel that it's a little bit safer. Personally, I'm not doing that. We're staying in. I find other things to do. I do have a garden, so I can exercise in the garden and I can keep fit in a garden. We are also reading, listening to music, probably the same as a lot of other people are doing, watching quite a lot of TV. So we're finding other ways for our personal enjoyment, but to try and keep ourselves a little bit safe. A lot of people have expressed to me that they actually like being shielded, that they've got more time to spend with their partners, the family, and I can see some perspective in that as well.
Thank you. And Steve, from your perspective?
Yeah, I think from my point of view, I've been fortunate in that I've been able to work from home, which has certainly helped spend kill the time during the day. I've not, as I said, I've not been totally isolating. I've been going out, not every day, I would say, but for a short period, 20 minutes, 30 minutes each day, just to walk the dog up to the local park, deliberately avoiding people, any close contact, stretching the 2 meters way beyond that limit, and trying to keep myself isolated from people. I think, as David says, it's a case of finding things to do. So when I'm not working, it's pottering around the garden or the house, catching up on a few jobs, but trying to avoid going out where you would normally do. And it's a case of trying to keep your mind occupied. As I say, I feel like I've gone back 3 or 4 years to where I was doing this before, when during my recovery from my transplant. So it's something that I'm familiar with, and it's not been difficult to step back into that regime.
Thank you, Steve. So, I mean, it raises a particularly good point that hopefully Helen will be able to comment on around. So we've heard at Leukaemia Care from a number of patients who have said they feel they've gone backwards in their journey, particularly those post-transplant. We've even heard suggestions that it's like PTSD, having isolated post-transplant before. Have you got any tips for those people, but also generally for people who are now shielding and being asked to stay inside, things that they can do to protect their mental health?
Yeah, I mean, I think it is really challenging, and also that each of us, like with anything else where we're told what to do, we will make our own decisions about how much we follow the guidance. And ultimately it is a balance, isn't it, between doing what you're told, reducing the risk, and not going mad, you know, in the sort of normal sense of the word, if you like. So we all have to find our own ways to do that, and it's extraordinarily difficult. I think the PTSD question is an important one. I think there's almost a query of, is that normal to sort of re-experience some symptoms from previous experiences around perhaps transplant and isolation or diagnosis, things like that. Certainly it's a common experience. It's not normal in the sense that it's not everybody that would experience that, but it's very much within the normal range. It's very common for people to experience trauma symptoms as a result of diagnosis and treatment across many conditions, but certainly within blood cancers. So I think if you feel that you're experiencing those symptoms, don't disregard them, is what I'd say. So, you know, go through any normal channels you have for support for those things, and potentially even seek help you might not have sought before. So I suppose there are going to be different channels for each person locally, but across the country, anybody can access psychological therapy via their GP. And at the current time, obviously, it's more difficult than usual. So I don't know what impact that will have on waiting lists in your area. But therapy is currently mostly being done either by video like this or on the telephone. And that does include trauma work for a lot of areas. So that's patchy, like a lot of things. But those forms of support are available. In terms of managing shielding, I think particularly for those who feel they've gone backwards, I think that's really tough because it feels like you're suddenly being told by the government not to do everything when otherwise, health-wise, you should be okay. And I think, quite honestly, each of us has to manage risk in our own way. So every one of you will be doing something slightly different. Because if you took the letter of the guidance, you wouldn't be touching your partner at all, if you have one, or your children at all. You'd be first in the bathroom, you'd be changing towels every 2 seconds. You know, it does feel unmanageable, I think, to really follow the guidance to the letter. So I think for each of us, we have to work out what is our balance. We need to manage risk, obviously, but if the impact of that risk management is so extreme on your mental health, then I think you have to find your own balance. And if that means exercising outside, then yeah, I mean, I'm not going to tell you not to, because it's not my job to tell you to stay at home. But I think you have to do it in a way that feels right for you and also for your family members. I think, you know, David made a really good point earlier that this is a huge deal for everyone's family. And even if that is not a family that you live with. So I think there are certain things that you could do in the current circumstances, whether you're or not, you've tried them before, and particular things that I suppose could have sort of general appeal would be things like mindfulness, and potentially things that also like yoga or Pilates, which often incorporate mindfulness. There are a huge number of apps available for mindfulness. A couple of sort of big ones would be things like Headspace, Unmind, Smiling Mind. There are lots. Some of them are free, some of them you have to pay. But there are certainly ways of introducing new sort of skills, if you like, tools for coping. But I guess also it's important to say that you will feel pretty rubbish quite a lot of the time through this. And that feels really normal. That feels like that's the right response to this situation. If everyone felt great all the time, I'd be worried for you.
Thank you. A few very specific questions around mental health have come in during that. One is, do you have any specific advice for people who are living alone during this period and the mental health impact of that?
And I think it's particularly tricky, especially if you don't even have a pet, because I think physical contact is so important. And the full-on isolation of being shielded at home on your own is extraordinarily challenging. I think the problem is that there are lots of things that you can sort of bandy around that sound great, but the reality of trying to do it isn't always the same as it sounds good. I suppose it's about knowing yourself to some degree. So people will give you all manner of advice. And if you tried to do everything everyone told you, you'd probably go bonkers just by trying to do it. So you sort of have to, in some way, recognize what for you is either most important or most difficult right now. And that might be about social contact, that might be about having downtime, that might be about managing working from home and how difficult it is with everything kind of all mixed up together. Some people are working ridiculous hours because they just feel like they're never home. So I think trying to find ways to delineate home and work, or to check in and link in with family and friends can be really important, because I think the social contact aspect of this is very important. I suppose managing the sort of the stuff in your head, what's going on with your thoughts, what's going on with your emotions, is probably more about finding tools and skills that you can develop and you can work on, that you can sit and practice things like relaxation and mindfulness. Even things like exercise can be really important to get some adrenaline out, to use those kind of hormones, if you like, in a functional way. So, but it is extraordinarily challenging.
Thank you. So, I mean, one of the points you raised, Helen, was around family and the practical impact from that. So, Sandra, if I may ask you a couple of questions in relation to this. So, for people who are being asked to shield, but live with others who are not shielding, should they also be shielding? Should their family members be shielding?
The advice is that they shouldn't be shielding, that they would fall into the same category as the rest of the population. They should be staying at home. I know some of the advice has changed over the last couple of days. We're still trying to get our heads around the sheer volume of changes that may be coming our way over the coming days and weeks. But the guideline is to stay at home, although we know that there have been changes in England. They've not been necessarily felt in Scotland. There are some synergies, but you know, there seems to be some differences, I'm sure everybody knows, across the devolved nations. But you know, people should be following the stay-at-home advice. I know there's some changes that have come with respect to working and so on. I think if you are working, then you know it's important to have a conversation with your employer about your current situation. Obviously, if you've got a partner or a loved one at home who is shielding and you're their carer, for example, then you would want to have a chat about that. I know that we're probably coming to this later, but yeah, the advice has changed. But as an organisation, we're starting to work out what that means for specifically for myeloma patients and their families, as well as you know other patients with related conditions. So there are changes that are coming and they're evolving quickly over time, but we are keeping abreast of that. But yes, in the meantime, shielding, if you've got a family member who's shielding, then you should try to follow the stay-at-home advice. But obviously there are changes that have come through with respect to working as well that we are trying to get our head around for those families who are affected by that.
Thank you. And obviously, just to be really clear, any guidance that's come out in the last couple of days in terms of the plan of people potentially going back to work doesn't apply to those who've specifically been told to shield. The shielding guidance supersedes this. And I've seen many questions coming in about whether we know what the guidance is going to be on shielding beyond the current period, whether it's going to be extended. Again, it's one of those questions we really can't answer at the moment, but hopefully that in itself is an answer that we really don't know. So there's not really anyone who can give you that information at the moment. We just have to proceed on the dates that we know shielding is happening at the moment, and hopefully more guidance will come out well in advance of that. Obviously, there are a number of concerns for those who the guidance where family members are being told to go back to work, and I think we should probably talk about a couple of those. I mean, so Jill, one of the questions we've had is around if you live with a vulnerable person and you're being told to go back to work, will that put the family member or other person that you live with who's vulnerable at risk?
It's difficult, and every case is individual. Like a lot of things, one size does not fit all. But certainly from blood cancer UK, we are experiencing a number of calls from patients and carers who are in that situation. And I think it took us, it took people quite a while to get used to being, isolating or shielding and what all that was and what that meant for them. And I think then they settled down. But now always feels like we're starting to come out of it, and that's increasing anxiety for people. Really, quite a lot of people have been saying that they are concerned about that very thing, that, we're being forced, we're going to be in a position where we have to go back to work, and I am not happy then going out, particularly those people who have been avoiding maybe frontline work for this period, but are now in that situation when they have to go out to work. Will that affect my relative at home? Does that make them more vulnerable? Will I be supported not to go to work? And if I'm not, and then, what are the financial implications on that? the advice is, the government advice is that if you're not vulnerable, then you shouldn't be shielding. And the latest advice is if you can go to work, then you should be encouraged to go to work. What the financial implications of that are for people, I don't know the answer, actually. Somebody else on the panel might be able to answer that. But I absolutely understand why people are concerned about it. They've done such a good job of keeping people at home and trying to keep them safe. And it feels like a completely different message. So we completely understand why that is raising concerns and anxieties.
Thank you. And just as a kind of comment more than a question, one of the other things people are already asking about is children returning to school, yeah, and what risk that will create. I mean, I don't know, Sandra, whether you have any comment to make on either that or the previous question.
I think, again, it's quite challenging. I think knowing, what we do know is that if a person who's shielding has a child who, you know, has been asked to go back to school, it's very complicated because they've said that they can go back to school, but if they are able to distance them, so undertake social distancing, which is going to be incredibly difficult in a school environment, because, you know, children want to play with each other, obviously. So how that can be achieved in the school system, I don't know, but ultimately that's what the advice is. Otherwise, they can keep their children at home. Again, it's going to be very difficult for some families to achieve that, and what that will look like both from a practical point of view in terms of a child's education, we don't know, but equally in terms of the family's ability to function, go back to work if they have to. There are lots of questions that still need to be answered, and at this time we don't necessarily have all the answers, I'm afraid, but that's what we've been told at the moment. In terms of risk, again, it's an unknown. What they're saying is you should be able to social distance at school. I don't know how practical that's going to be for many children, and for schools to monitor and manage. So there are lots of difficulties there, and I think you know, we're all trying to grapple with how that's going to work in reality.
Thank you. So we've seen some very specific questions come in for those who are shielding. So I'll start with Jill, but if others have comments on these as well. Disinfecting deliveries of shopping, is that something that people need to be doing if they're shielding?
The advice is that that's probably not required. You know, we're learning every day. This is a new virus, and it's, you know, each day brings some new challenge and some new question. The advice is that we don't really know how long the virus lives on surfaces, but probably not required to do that. But I know that people are doing it because they're concerned. And I guess in that situation, you have to do what you're comfortable with. You know, it's kind of common sense that if you're having a neighbour drop off your shopping, or a family member, or an online delivery, it's keeping that distance when your shopping arrives and making sure that it's left at the doorstep and that you're not taking it directly from somebody. But when it comes to wiping down packaging, then no, we would say that's not required. But if that's something that you're more comfortable with and you feel that gives you extra protection, then you know, that's a personal choice.
Thank you. And one of the other questions we've had is around the government guidance to stay away from others in your home as much as possible, clean down surfaces, to socially distance for 2 meters from those in your home. What would you say about that, Jill?
Good luck, I would probably say, because I think it's incredibly challenging. You know, that's fine if you live in, you know, the stately home and you can, you know, take yourself off to the East Wing and leave the family in the West Wing. But, you know, practically, if you're living, you know, a partner, perhaps 2 or 3 children under the age of 5 in a 2-3 bedroom flat, it's virtually impossible. But it's just kind of keeping the message out there about trying to distance as much as you possibly can, increasing hand washing. If somebody has, you know, maybe a bit of a cough or a cold, it's making, you know, distance, make sure that you distance if you've got anything like that. But day to day, as one or two of the other panelists have said, is, you know, it's incredibly challenging. And and kind of almost damaging to your mental health as well. I think if you're not able to, cuddle your children or tuck them up in bed, it's maintaining good hygiene as much as you possibly can is really the advice, because otherwise it just becomes impractical.
Thank you. And I've
Just-
seen.
sorry-
I was just going to
sorry.
refer to you.
Yeah.
You go.
Just tried to cut in. I guess it's making me think as we're answering some of these questions that there's a kind of a common theme around how do we manage risk? Because actually people are saying, can I do this? Should I? Is it riskier? And I guess the answer to almost all those questions is yes, it is riskier. So yes, going outside is riskier. Yes, for any family member, going to work is riskier. Having children go to school is riskier. All of these things increase the risk. The lowest risk is not to see anybody, touch anything, do anything, but that's completely impossible. So I think it really is important that for all of us, we find our own balance. For some people, washing down the shopping will make them feel better. And if it makes you feel better, what harm? The problem is that for some people that actually won't make them feel better. It'll just make them even more hyper alert to all the things that are making them anxious. In the same way that we all have a different level of anxiety and we deal with anxieties differently day to day. Some people will always, when they're crossing the road, they will never press the button on a pedestrian crossing with their finger in case they picked up someone's germs. There's so much difference in how we all respond to danger and anxiety that we sort of have to retain our own sense of self with that. But with something that feels as dangerous and as scary as coronavirus, we are a bit screwed because it's never going to feel okay. Almost nothing feels okay in terms of finding a balance. So, having a family member go back to work feels pretty horrendous if you're being told to shield, especially if their work involves handling things or dealing with lots of people. So I think ultimately, any of these questions, there's no right answer. There's guidance which will feel incomplete or inappropriate often. But I think it's important to know what the guidance is and then to find your own balance in the same way that you'd find your own balance in following medical advice normally. I mean, who actually takes their treatment as recommended? So it is all about your own balance and understanding yourself, I think, in terms of how do you manage the anxiety and the stress. And if you can't deal with life without touching and hugging your family, then hug and touch your family.
Thank you. I mean, that's a nice segue. So perhaps David, you could comment on your own balance and where you kind of are dealing with this.
Yeah, I'll be honest. Going back to the whole shielding question, there's so much anxiety around going out in the world, and for the people who are shielded and the people who are listening in here, I think it's a question of feeling safe. A lot of the comments I've had is that most people don't really feel safe going out until a vaccine is available for a lot of people. My own circumstances is that my wife she's a primary school teacher for the younger ones, and she's expected to go back to work in June. Obviously, the impact on our own family is potentially serious because we're all really concerned what happens when she starts and she's mixing with a lot of 4 and 5-year-olds and potentially bringing back all kinds of things. What do we do then? And I guess a lot of people out there are thinking the same in whether the partners, husbands and wives are in various workplaces where they're going to have the same kind of anxiety. And it's an ongoing anxiety. It's not something that you can kind of put to one side and kind of ignore. And I think for a lot of people who are listening in, it's going to be something that's going to be ongoing for a while that we're going to try and deal with as best we can.
Thank you, David. And Steve, what's your perspective? And what's your kind of balance of the risks?
I think everyone's different. I think that's the difficulty. Everyone will deal with this different ways. For me, I've been coping fairly well, I think. I've been able to keep busy. My wife is in a position where she can work from home. I have twin 18-year-old sons who their A-level studies were finished abruptly, so they're no longer at school and they won't have to go back. Fortunately or unfortunately, we were able to get them some temporary work, and they've been working in one of the food warehouses, a frozen food warehouse, helping keeping the country moving. But they're the only ones in effect who are going out each day to work. But we have been trying to enforce a regime where when they get home from work, that they certainly wash their hands, have a shower shortly after arriving home from work, and get changed, so that we're minimising the risk of any infection transmitting from them. I think really that's the way that we've coped with it as best we can.
Thank you. So one of the questions that's coming through quite a bit is around if the shielding period gets extended, and obviously we don't know whether that's going to happen, but a lot of people are particularly worried about that. Helen, do you have any comments on coping with uncertainty in that situation?
I think uncertainty, as I said earlier, is one of the most challenging things for all of us. I guess one of the things is about how we manage our own expectations. So if we think there's an end date, we sort of pin our hopes on it often and almost try and have plans for how we will be in future. And if those don't go to plan, it can feel worse almost than if we didn't have those. So I guess in a way, one of the challenges is not to sort of set targets or expectations for how things will be. It's particularly hard if you've got things you were expecting to do at some point later in the year, or important things within the family, you know, weddings or other events that you're sort of hoping will still happen. So I think you can't stop yourself from hoping that those will happen, but I think as much as you can, trying to kind of set your own expectations in a way which feel manageable for you. And in a way, it's probably better to assume it's going to go on forever, assume it's going to be a year when it almost certainly won't be, and set yourself up to manage that, set yourself up to be able to do it, rather than hoping and keeping your fingers crossed and sticking your fingers in your ears and going la 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 and hoping it'll all be over really soon, because I think it won't be over soon. It will be different soon. So shielding will presumably finish at some point, but the risks will probably feel worse when the shielding stops. So you might be less cooped up, but you might feel worse in relation to anxiety. So I guess perhaps if you can use this time to develop your skills and your strategies for managing anxiety, that you can do your best to equip yourself, if you like, then whatever the next steps do look like, hopefully you've given yourself the best possible chance of managing those. Having said all that, as I said earlier, you'll probably feel pretty rubbish. I mean, I work from home and this is pretty rubbish for me, and my life is nothing like what shielding is like. So I think it just feels really normal to be anxious, really normal to be upset and feel like you're on some kind of weird roller coaster. You know, if you're used to being quite steady, you won't be feeling very steady right now. If you're used to struggling, your struggle will be worse, almost certainly. So I suppose not expecting yourself to be okay feels important. But again, there's no one size fits all. And I suppose I would say that constant sort of combing through news and social media and stuff can drive you up the wall. So a lot of people are finding that it's been important to restrict the amount of information they kind of access and how to do that as well, so that you manage to have conversations that are not about coronavirus, that are not about how long this is going on for, that are not about should I touch this, touch that, or touch the other. So I think maybe protecting those spaces in your life where you're able to do things that actually feel normal might also be quite important.
Thank you. So one of the other questions we've had is around hospital care at the moment, and hospital care is one of the exceptions where if you're being asked to come into the hospital, for example, for a blood test, that is an exception to shielding and a reason why you may be asked to leave the house. Could you comment about that, Jill, and why that's the case?
Yes, I mean, obviously for anybody that's got a blood cancer diagnosis, there is some degree of monitoring depending on where you are on your journey. And I really want to reassure people as much as I possibly can. I completely understand why it seems like a separate message. You know, on one hand, you're told that you've got to stay home, you've got to avoid people, you've got to protect yourself. Oh, but you can come out and do this, which seems like the riskiest thing to expose yourself to. But to reassure people that hospitals want patients to come out, and they are making provisions so that those patients are as safe as they possibly can be when they attend a hospital appointment. So I would encourage people where, you know, a lot of the appointment systems are being done via telephone or video conferencing, but there are occasions when patients absolutely need to go to hospital to be seen physically, to have a blood test, to have a scan, whatever they need. And to just reassure people as much as I possibly can that hospitals are aware of the risk and aware that those vulnerable people are coming into their department, into their hospitals, and they are making provision to keep them safe. There's been a lot on the news recently about the you know, kind of lower rates of presentation from patients, and the message from clinicians is really to get blood cancer patients back in and get them seen, and where we possibly can get business returning to normal. So the clinicians in the hospitals are really trying to get patients back in and to maintain these appointments, because this is not going to be over in a week or 2 weeks. We don't know when it's going to be over, and we have to keep people as well as we can and as safe as we can during that, and that can be attending hospital appointments.
Thank you, Jo.
I absolutely agree with that. Sorry, Zach. But I think also, again, working in hospital, I think it's really important that people feel that they can come if they need to come, and also to discuss it. So if you're unsure, your instinct is not to go, even though you've been asked to, call your team, speak to them. Don't just sit at home and not attend. Try and have that conversation so that your worry can be addressed, because you might find that they've actually already thought of the thing you're worried about and they've got a plan for it. So, you know, they have different sort of streams for patients with different difficulties. They're keeping people very separate. They're keeping staff separate. They're doing all manner of things to manage this across, you know, every NHS trust. And I guess it comes back again to balancing of risk. So there's a risk to attending hospital, of course there is, and no one can tell you it's not riskier to go in than to stay at home in terms of coronavirus. But your only risk isn't coronavirus. And that's the problem that you face, is that you have other risks, and your other risks relating to your blood cancer are significant. And you don't know necessarily how significant they are until you've found out. So the need to go to hospital is, as much as anything, to make sure you are managing the different risks appropriately.
And just to follow up on a question, I'll let you comment in a question in a second, Sandra, because I'm going to ask you the question. So the question was around telephone consultations, which Jill mentioned, and many patients are having their consultations via teleconference or via video conference, and how you make sure that you get the most out of a conversation like that, where it may be more difficult to communicate than in person.
Yeah. Sorry, is it coming to me? Yeah. Yeah, it's just coming back to something that was said before I move on to that. It is important that patients are able to get in contact with their haematological team if they have new symptoms or they're presenting with something different, because it is important that their team know, especially if it's something that's it's something new, or it's been their symptoms have got worse than previous. So the haematology team, your doctors and nurses, really do want to know if something has changed, and it is important that you get in touch with them if and when that happens. Some consultations, yes, they are taking place over the telephone. I would suggest that they try and write down their questions on a piece of paper before they start their appointment. Anything that they are particularly concerned about, whether it's blood tests, whether it's new symptoms, whether it's a change in treatment, whatever it is, actually note these questions down prior to starting the appointment, and then you're prepared for what comes next and being able to get the information out that is relevant to you personally. So it's about making sure that you're able to have a conversation, because we do forget what we want to know, and once the appointment's gone, you kind of sort of think to yourself, I should have asked that, I meant to ask this. So go prepared, make sure you write down everything you want to know, and do feel empowered to ask, because the clinical team want you to feel as if you've got all the information you need at the time to make the right decisions for you.
Okay, and did you have anything to add to that, Jill?
No, I would agree with that, and I would it's my advice that I would give to patients when they're going to face-to-face appointments as well, actually. Even going into the hospital, even if it's familiar and it's something that you do regularly, there is something about crossing that threshold, usually into a consultant appointment, that people's mind goes blank. They get nervous, they feel intimidated, And I always say to patients, write it down. Whatever it is, have a piece of paper, carry it around, carry a notebook around with you at home. And any time you think of something, write it down. Because you know that even when you're face to face, you go into that appointment and you're bombarded with information. You know, health professionals have an agenda. We want to tell you, we want to gain information, and we want to give you information as quickly as we can. We want to give you your blood results. And if you've written it down at the end of the consultation, being able to say, actually, I have 3 or 4 questions, because they might not have been addressed throughout that consultation. And I think that's whether you're face-to-face or telephone conversation. I think that's a really good plan for patients to do that.
Thank you.
Could I just come back on one thing? Just to say, sometimes it's hard to also listen and write everything down when you're in an appointment. Sometimes it's quite handy to have another family member there taking notes for you, because you might not recall everything at the end of the conversation. So again, coming from what Jill said, we would recommend that in an appointment, and also if it's a telephone consultation. So do have a pad, do have a family member there if you can, obviously at distance, taking some notes to help you to remember what was said in the appointment as well.
And
thank you.
You might be able to record the conversation if you're having a telephone conversation or a Zoom. If you've got the facility permission to record it, then that's something that you might find helpful.
I've certainly sparked a flurry of comments there. But so we're now coming to the end of the webinar, unfortunately. Firstly, apologies to anyone who's asked a question that hasn't been answered. Please do get in contact with one of the charities involved or with your healthcare team to follow it up, and hopefully one of us can answer that. We've just had so many questions coming through that it's not been possible to do all of them. And then the second point to make is a big thank you. Thank you to all of the panelists for giving up their time, for joining, and also to all the blood cancer charities who've been involved in coordinating this. I know it's a 1-hour Zoom thing, but surprisingly, it's been a huge amount of work to get everybody together at a time. So thank you, all of you guys, for joining. And I hope everybody who joined the webinar found it useful. If you do, please do let one of the charities know, and hopefully we'll try and organise some more of these again in the near future. So thank you very much for everyone. The chat's now exploding with thank you comments. So I hope people found it useful.
Can I just,
Thank you.
it sounds like we've kind of been slightly negative and stressed how difficult this shielding and the isolation has been. Yet actually some patients tell us that it's been quite positive. It has actually given them an opportunity to spend time doing things with family members where they've not had that opportunity before. And so out of all bad things, sometimes something good comes out of it. And for some people, they will be developing different relationships and different ways of working and socializing that will be beneficial. And so there are some little positives perhaps as well to take away from it.
Agreed. As I think Helen said earlier, you have to find your own balance and you have to look for the positives. So thank you everyone again for joining. Again, the chat's still exploding with thank you comments. This will be available as a recording, so if you missed bits of it, you can go and watch it on any of the Facebook channels from the different groups that are broadcasting it at the moment. So thank you very much. Take care and stay safe, everybody. Goodbye.
Thank you. Bye-bye.
Bye.
Goodbye.